We've had, quite a number of people go through the program, so I'll just share their stories with you quickly, because really it illustrates really how powerful this new concept is. So the first case we have is Richard, who's here today. And so he's had diabetes for about 10 years now, and he's had a few complications, including some kidney disease, which is why he was here in this office. And he saw a colleague of mine, Dr. Ting, and so he was referred into the intensive dietary management program, and we started him in June of 2013. And we started him with a fasting regimen as opposed to the amount of insulin that he had. So this is Richard and his wife. Oh, I can't see that very well. And this is what's happened to his weight. So his weight, starting just above 250, has been steadily coming down. And it's down to 210. His waist size has continued to come down. And his hemoglobin A1C, which is the measure of his sugars, has stayed relatively stable, below 7%. And this is him now. So if you look at what has happened to his insulin dose, so he started off with 55 units of insulin. And within, 6 weeks, he was off of all his insulin. In other words, his sugars are doing fine, and he's off of all his medications completely. And his levels of A1C are no longer at a level where you could make this case that he is diabetic. In other words, you could say that his diabetes has been cured. By using these kind of simple understanding of diabetes, you can see that this is actually the rational, but also the natural way to cure diabetes. We're not talking about piling on more drugs for you. I mean, you go to some of these places, they'll tell you to take these experimental drugs and they want you to sign you up for drug trials. No. What we're doing has been done for thousands of years and is in fact exactly the way they used to treat diabetes. But they understood that it was a dietary disease. It has to be treated with dietary measures. This is the second case, Balraj, who's here this morning as well. So he was diagnosed in 2003 with diabetes, and he also had some complications of that. And so, after treating him incorrectly for many years, I started him on the intensive dietary management program because, back then I didn't understand much of this myself. Much of this is new. So he started in August, and so his weight has come down a bit, but he started at 186 and he's come down, 8-10 pounds or so. His waist has come down, but you can see his sugars, his hemoglobin A1C has stayed very good. And this is his medications. So again, starting at over 40 units, about 40 units a day of insulin. So this is what he had to take. Within 5-7 weeks, he was down to 0. He is no longer taking insulin. He's no longer taking any medications for his diabetes. Which again, you could say, if your sugars are good and you're no longer on any medications, you could say that your diabetes has been cured. In essence, what we're doing is exactly the same thing we do with the stomach stapling surgery. So the stomach stapling surgery, the cure rates for diabetes are like 90%. But the benefits are because of the fasting. They cut your stomach so you can't eat. In other words, you're fasting. But if all the benefits come from fasting, why do the surgery at all? It doesn't even make sense. Just do the fasting. This is another case. He's not here, but he's a 45-year-old Filipino man, and he was just recently diagnosed with diabetes. He started with a hemoglobin A1C of 8.7%. So anything over 6.5 is considered diabetes. Anything over 7% is diabetes, but he was newly diagnosed and he really didn't want to start any medications. So I said to him, well, if you don't want to start medications, then come into my program and we'll treat you. And we'll treat you and therefore you won't have to take medications. So it had been slowly rising over the last 6 months, and what happened was that he started in June. His weight again came down. It came down about 3 kilos. But his A1C continuously came down. So you can see that his final A1C at the end of 10-12 weeks was 6.3%. So again, at a level that you wouldn't be able to say that he has diabetes. So in other words, this fellow, instead of taking medication and then later taking more medication, then more medication, then more medication, we're able to treat him right off the bat with a dietary regimen, and he's been able not to take any medications. In essence, his diabetes has been cured. So again, lots of cases. Another fellow, 66-year-old Chinese man, much the same story. Type 2 diabetes, which was recently diagnosed in 2012, and you can see that his sugars were really high. His A1C was 10.5%. I told him to try different things, but I just saw him actually in September of 2013, and his A1C was still 9.4%. And he didn't have a drug plan, so he really didn't want to take any medication. So I said, well, if you don't want to take medications, come into the program, and that should say September 2013. So we started him a few months ago, and this is what's happened. So as he's following the program, his sugars are coming down. Exactly what we would expect. And as you follow the program longer, you're burning off those stores of sugar, and your hemoglobin A1C is coming down. So he went from 9.4 to 8.4, and I just saw him at 7.3. So again, all without medications, and I'm hoping that he will never have to take medications. Another case, Desmond, he had some heart problems. He also had diabetes, and he's here this morning as well to share his story. He also had a bit of complications, the heart disease, the neuropathy. And this is what we did. Again, with diabetes, it causes all kinds of problems, right? So you get heart problems, you get kidney problems, you get eye problems, all kinds of problems. And the thing about it is that there's nothing we can do about those kidney problems or those eye problems, because it's the diabetes which is killing the kidneys, the heart, and all that sort of thing. If you don't do anything about the diabetes, you can't do anything about the kidneys or the eyes or anything else, because the root of the problem is the diabetes. So you have to take care of the diabetes. And the way that we had been treating him was making the diabetes worse and worse. So we started him on the program, and again, his weight has been slowly coming down. As you might expect, his waist size has come down, and his sugars actually have stayed very, very good. But if you look at his doses of insulin now, again, starting at about 25 units a day, we're able to bring him down, and now he's no longer on any insulin. We switched him instead to one of the pills, which is, for many reasons, is much better. It's safer, it's much less, you don't have to poke yourself all the time, you don't have to check your sugars all the time, but really he's been able to come down of all those medications. If your medications are coming down, you're coming off of the insulin, you're going on to pills instead, it means your diabetes is getting better, right? Before, every single year your diabetes was getting worse. And now, for the first time, we see everybody's diabetes getting better. It's reversing, because instead of having higher insulin levels leading to higher resistance, now we have lower insulin levels leading to less resistance. So you're actually driving that cycle now in reverse. And that's why it's working so well. And that's just a recent picture of him now. A couple more cases. So Frank, who couldn't be here, we asked him to be here, and he said that I think he was away, so he couldn't come, but he did want to come. He also had diabetes and kidney disease, and he actually didn't really want to start. He calls himself a grumpy old goat because he didn't really want to start. He didn't think it was great, but I kind of talked him into it. I said, you really should try it, because there's nothing to lose by trying it. If you don't like it, then you don't do it. But we were able to start him on the program, and you can see here again, his weight is coming down nicely. His waist size is coming down. His sugars are improving almost every single time. And if you look at his doses of medication, again, he started on 45 units a day of insulin. By the time we finished with him, he's on no insulin, and he's just taking a pill. So again, you can see that his diabetes is getting better. His sugars might go up and down. So the sugars actually get better as you treat the disease. Just like if you treat with antibiotics, your fever goes away because your disease is getting better. You don't have to treat with Tylenol, because if you get rid of the infection, the symptoms go away. It's the same with the diabetes. As you treat the diabetes, the high sugars goes away, because the high sugars was just a symptom. You can't treat the symptoms and expect the disease to get better. But as you treat the disease, the symptoms get better. So everyone here, their sugars are coming down. We're not treating the sugars particularly, we're treating the disease. Another fellow who is here, I follow for high blood pressure, and I've seen him for quite some time actually. And he was also diagnosed with type 2 diabetes as far back at least as 2004. He'd been on insulin since 2007, and his main problem was actually high blood pressure. But I said, well, you know, high blood pressure goes along with the whole metabolic syndrome. So in fact, the diabetes and the weight and the hypertension and the high cholesterol, they're actually all caused by the high insulin levels. So I said, well, with this high blood pressure, we need to do something. So I said, well, we need to get you into the program, because he was on probably 8 different medications for high blood pressure, and his pressure was still like 200, right? So we put him in the program, and what happened to him, his insulin levels, his insulin dose went from 70 units a day to right now 0. He's just on some pills. That's fantastic. That's fantastic. His blood pressure is getting better. His blood sugars, again, they go up and down. We can see that they're all within the normal range. But we went from 70 units of insulin a day to 0 in less than 3 months. So 5 years of insulin that he'd been taking every single day. Not getting better, getting worse. Over time, it just gets worse. But now it's starting to reverse finally. And another fellow who isn't able to come, but we call Mr. Yes, he much the same story. He had been on insulin for many, many years. And as everybody here, he started with a medication, then he took more medications, then he took insulin, then he took more insulin. By the time they were done with him, he was on 140 units of insulin a day. And that's not even that unusual. I see lots of people with that kind of high dose. So as we got him into the program, his waist size was coming down, his weight is coming down, his sugars are getting better, and he's not completely off insulin, but he's down to about 30, 40 units a day. So from 140 down to about 30 or 40. So significant improvement. I mean, because he started so high, it's going to take a little bit longer. But again, you can see that as you continue to do it, it gets better. And this is Robert. He's also here this morning, but he's done extremely well again. So the same story, type 2 diabetes, treated with medications and more medications and more medications. Finally, they put him on insulin, and then I recently saw him and I said, whoa, insulin, now this is not good news, right? So I said, forget that. We need to get you into the program. We need to get you treated correctly, because if you're not treated correctly, I've seen this movie before, it goes insulin, more insulin, more insulin, more insulin. In fact, his insulin dose went very quickly up to close to 40 units a day. So as we got him started, his weight started to come down, his waist size came down, his sugars got better, and look, within 3 weeks, he was off of all his insulin and just taking medications. Now we're working on getting rid of the rest of his medications. So that is the power of being able to treat it correctly. And these are not isolated cases. We actually see responses in the majority of patients, because we're doing the things the right way. If you do it the wrong way, you'll never get any benefit from it. And that's what we've been doing all along.